attended McMaster from 2002 until 2006, and I completed a double major in linguistics and psychology. I am working as a speech language pathologist for William Osler Health System, which is a hospital health system comprised of Brampton Civic Hospital, Etobicoke General Hospital, and Peel Memorial Hospital. The role of a speech language pathologist is a really challenging question to answer because it's a really dynamic profession. Working with people of all ages, essentially infants up until geriatrics, so it spans the entire age range, and even the areas in which we help people is quite diverse as well. Some speech language pathologists work with an adult population, and I would say the two main domains are communication disorders and also swallowing difficulties, the medical term for which is dysphagia. We execute assessments and then develop intervention plans and perhaps provide a treatment program for the difficulties or the impairments, although all of that depends on the service delivery model for the place which you work. I would say that my undergraduate degree literally paved the way for my career. I was fortunate enough to know, or at least to have a sense of what I wanted to do. So during my undergraduate, I was looking to acquire the skills and the prerequisites in order to apply to a Master's of Speech Pathology. Whereas I know many students, start your undergrad and you're trying to figure everything out, and you realize maybe a year or two later, okay, I gotta backtrack and get this or get that. I was kind of building right from the beginning. In terms of the skills that I acquired, of course there's the theoretical knowledge, right? So having a degree in linguistics is hugely beneficial to pursuing a career in speech pathology. I actually found that I was assisting and kind of mentoring some of my speech pathology colleagues, or I should say like my peers, during my master's program, because I felt like I had such a strong foundation in phonetics, syntax, semantics, all of the things during my undergraduate, looking at the structure of language and the function of language, and then transitioning into my master's, it was more looking at the dysfunction of those systems, the breakdown, the deterioration of language. Like I had mentioned before, I think very fortunate to kind of be passionate about something from a very young age. So I would say probably by grade 10, grade 11, I was fascinated by language. I took Latin through high school, and it was my high school Latin teacher that kind of got me interested in how dynamic language is as a system. I should say that I've also always been interested in the sciences, always interested in medicine. I've always envisioned myself working in healthcare. Volunteered in hospitals from a young age. So I had this love of language and this kind of, affinity for medicine. And through my undergraduate and through discussions with professors, Dr. Morrow being a very influential part of my undergraduate, realized I could bridge my love for language with my love for science and medicine, and realized there was a career out there, or a field of study that looks at the breakdown of language. I have done a lot of volunteering in my days, so probably mid-late high school I started volunteering in a hospital setting. And you know, so many people run from a hospital, but I've always kind of been attracted to it and learned that I was comfortable in that setting and I enjoyed it, and you know, it was challenging and interesting. Once I started my undergraduate and realized that I wanted to pursue speech language pathology as a career, you're faced with, I got to figure out how to get into this program, right? Because it's pretty competitive, and you know that you're surrounded by peers that want to do the same thing. And so most of the master's programs do place a heavy emphasis on volunteer experience, which is smart because it's those experiences that help you figure out, do I really want to do this? Following my volunteer opportunities with children, I actually was able to obtain other placements with an adult population. And it was at that point that I thought, I can do this, I want to do this. I want to work with adults and I want to work with language. Following my undergraduate, or I guess towards the end of my undergraduate, I decided I want to do this. I'm going to apply to programs in speech language pathology. So in well, actually not just the province of Ontario, but in Canada, to be a speech language pathologist requires a master's degree. The type of master's degree depends on the institution in which you study. I studied at the University of Toronto. There it's a Master's of Health Science. So it's a 2-year program. It runs more or less year-round with a little bit of opportunity for break, but it's nicely balanced because you get an academic component and then you get a practical component, and it allows you to kind of take the theoretical academic knowledge that you've obtained and then apply it in practice. There are so many things that I love about my job. Probably the thing that I love most is that every morning I'm eager to get to the hospital, and I'm kind of eager to see what my day has in store for me. Being a speech language pathologist in the field that I practice in, it is constantly challenging. It's constantly stimulating. You're faced with clinical scenarios every day, some of which you feel, okay, that was routine, and some of which you're thinking, I've never seen anything like that before. And you know, you scoot off to talk to a colleague about it, or you hit your textbooks, and you're just thinking like, okay, I've got to wrap my head around what I just saw and how am I going to help this person? And really helping people, that's what it is at the end of the day. So I bet if you ask most speech pathologists, they would say what they love most about their job is the opportunity to help people all day, every day. McMaster offers a program that is, I think, well designed in order to prepare students for entry into speech language pathology, or at least prepare them to apply to the program, right? Whereas when I was a student, I kind of did the double major in linguistics and double major in psychology, and I guess I kind of made that program for myself. But I know that McMaster has, I guess, evolved since then, and I think is actually serving this student population really well in terms of the students that are looking to pursue a career in speech pathology. If you're considering speech language pathology as a career, you need to get out there and see it in practice, right? Try and shadow a speech language pathologist. If you can, get a volunteer placement, even if it's, again, like a shadowing experience. It doesn't need to be something that's 6 months long. Once you've decided that speech language pathology might be the career for you, you need to commit yourself. because you're going to be applying alongside many, many peers that also see it as a career for themselves. And you know, the admission committees for these programs look at various aspects of what you have to offer. So academics are of course very important. You know, you need good grades through your undergraduate years. You need to make sure that you've got your prerequisites. You need to make sure that you've got your volunteer hours. You need to write a personal statement and, you know, put a lot of time and thought, and I think passion behind it, to kind of help you stand out or rise above your peers and your colleagues that are applying for the limited number of spots within these programs.